Hey Connor, how are you doing today?
Good, how are you?
Doing well.
Good.
Alright, so now you've been having some pain into that neck, and we want to try some cervical traction with you today. So have you had that done before?
Nope.
Alright, so we'll be on this table right here, and essentially what we're going to do is we're going to hook you up to the device, and it's going to provide a nice distraction, or like just separation, so kind of giving you a nice stretch into the neck. It's not going to be anything that's painful. It's more going to be a nice, good stretch through the neck, kind of create some space, help relieve some of those symptoms that you have been having in that middle neck.
Okay.
What you don't want to feel, or what you won't be feeling, is like a pain or burning in the neck, into the arms, into the legs. So if you feel any of that at any time, just let us know. We'll also be giving you a stop bell too, so if you do feel that discomfort, you're in control and you can stop that.
Okay.
Before we get started though, I do want to ask you just a few questions just to make sure we're safe to proceed. So do you have rheumatoid arthritis or any other kind of autoimmune or connective tissue diseases? Any history of cancer?
Nope.
Past or present? No? Are you taking any steroid medications at the moment? Okay, good. Have you had any like dislocation or spinal injuries recently? No fractures, nothing like that? Okay. Any surgeries into the neck or into the spine?
Nope.
Nope. Do you have osteoporosis?
Nope.
Nope. Any like blood clots or artery issues should be aware of?
No, not that I know of.
No? Okay, perfect. What about any respiratory problems like COPD? No. Are you claustrophobic at all?
Nope.
Pregnant, trying to become pregnant, maybe pregnant? No? What about any like hiatal hernias? No? Alright, and the last one here, do you have any hypertension, or are you on hypertension medication?
Nope.
Alright, good. Well then I think we are safe to proceed here. So, what I'm going to have you do, Connor, again, like I said, we're going to get you set up into that device. It's going to provide a nice distraction and a nice pull to help create that space. So I'm going to help lay you down here, and I want your neck pretty much to be right in here. But let me just make sure first we're in the right spot. So we're trying to target that middle part of the neck. So we just got to make sure this device is set up to the right angle here. We want about, for that mid-neck, about 10 to 20 degrees here. So let me just double check that we're in the right spot. And it looks like we should be good right there.
Okay.
So when you're ready, Connor, I'm going to have you scoot on back and then lay your head into that. Scoot up just a little bit more. Does that feel like your neck's in there all the way?
Feels a little tight.
Tight. Let me open that up for you here first. A little bit better? All right, perfect. Now I'm just going to feel back here. I just want to make sure there's enough space, or it's nice and snug. You don't want to be, you want to be firm in there, but you don't want to be uncomfortable. So just let me know how that's feeling.
It's fine.
That's fine right there. Looks like we're in a good spot. I'm just going to put this strap on here. Again, it's going to be firm around the head, but it shouldn't be too tight. So again, just let me know how that feels for comfort.
Okay.
You feel
Yeah,
good right there?
Yeah, feels good.
All right. And before we get started here, I'm just going to have you lift up your legs. All right. And then, like I mentioned earlier, Connor, I'm going to be giving you the stop bell right here.
Okay.
So at any time you do feel that discomfort, you want to stop the treatment, any pain, anything like that, go ahead, hit that red button. It's going to stop right away. And then let me get you started here. Since this is your first time, we're going to go for a shorter duration. We'll go for about 10 minutes here. It's going to provide about a 20-second stretch, and then it's going to give you 20 seconds of rest. So it's just going to be alternating 20-second stretch, 20-second rest for the whole 10 minutes. And then we're just going to go for a little bit of a resistance, nothing too heavy here. How much do you weigh?
150.
150, so we're going to just go about like that 70% there of that. So it's just going to be a nice light force. And we're going to go 10 seconds on, or 20 seconds on, 20 seconds off for that 10 minutes. Before we get started though, I do just need to make sure that this table's locked, which it is. So we are safe to continue. All right, Connor, so I did start it right there. You will be feeling that stretch. Just let me know how you feel.
Okay.
Okay, Connor, still feeling good there?
Mm-hmm.
All right, perfect. So our 10 minutes has passed. Connor, you still feeling good?
Yep.
All right, perfect. So I'm gonna get you out of here, but first, I'm just gonna turn off the device. Right here, I'm gonna unhook this. Before we do get up though, I just wanna make sure that everything's feeling all right. So I just want you to rest here for about 3 to 4 minutes. Just relax, there's no more tension onto the machine. We just wanna allow everything to relax and settle before we sit you up, okay?
Okay.
I'll take this off you as well. So we'll just relax for a few. All right, that time has passed, Connor. You still feeling good?
Yep.
All right, perfect. So we're gonna get you set up first. I'm just gonna take this bolster from your leg and you can have your legs nice and straight there. Good. I'm just gonna loosen up a little bit more. All right, so before we sit up here, just gotta be a little bit careful with how we get up. So I don't want you to move your neck too much. I want you to move your whole body. So when you're ready, I'm gonna have you just turn towards me, really without moving that neck. I'm gonna grab your glasses there. Okay, just leave that neck right there. Wait here just for a second. You feeling all right there, Connor?
Mm-hmm.
All right, perfect. And then when you're ready, I'm gonna have you sit on up and keep that neck nice and straight. Good. How are we feeling there, Connor?
Good.
Good? All right. The last thing, I'm just gonna move this table down here for you.
Mm-hmm.
And lower here, so just be careful. All right. Table's lowered there, so we're all good. How are you feeling?
Good.
Good. All right. So next time we meet, we'll try this again. See how everything's been feeling.
Sounds good.
All right. We'll see you next time.
All right.